Welcome to the Tenet Healthcare Medical Minute. I'm Julia Yarbo. Our topic today is Alzheimer's disease, and joining us is Dr. Jennifer Buczyner, a board-certified neurologist specializing in headaches and neuromuscular disorders. Dr. Buczyner practices at the Palm Beach Neuroscience Institute, and she's also a member of Tenet's Advanced Neuroscience Network. Dr. Buczyner, thank you so much for joining us.
Thank you for having me.
What exactly is Alzheimer's disease?
Alzheimer's disease is the most common form of dementia and consists of a slowly progressive cognitive decline in multiple domains.
Who is most prone to getting Alzheimer's disease?
Several risk factors for Alzheimer's disease, two of which include advancing age and a family history. In Alzheimer's disease, we use the rule of doubles for prevalence. So at age 60, your risk is 1%, and every 5 years, your risk doubles. Other risk factors include things like depression, being a female, high blood pressure, cholesterol, diabetes, poor exercise and physical inactivity, and a history of any substance or alcohol abuse.
Do we know what causes Alzheimer's disease?
The thought right now currently is that accumulation of several proteins in the brain, in particular amyloid, may contribute to the pathology in Alzheimer's disease.
Is it hereditary?
There is thought to be a hereditary component to Alzheimer's, and what we do know is that when you have a first-degree relative with Alzheimer's, your risk increases 2 to 4-fold. Additionally, if you carry a specific genotype called the ApoE4 gene, your risk is much higher down the road to develop sporadic Alzheimer's disease.
So how do doctors diagnose Alzheimer's disease?
We typically diagnose Alzheimer's disease in patients presenting with a slowly progressive memory loss that is not explained by any other condition which may cause this. In particular, we'll do laboratory evaluation and neuroimaging with either a brain MRI or CAT scan to exclude other causes.
What are the current treatments associated with Alzheimer's disease?
The current treatments that we typically use involve medication and non-medication therapies. We typically use a class of medication called acetylcholinesterase inhibitors. These are thought to slow down the cognitive decline and prevent progression of Alzheimer's disease. We recommend things like increasing socialization, increased sleep and good sleep hygiene, as well as caregiver support and family education.
Is there anything you can tell us from a medical perspective that will help those that are coping with this disease in their family?
I typically recommend to get involved with the Alzheimer's Association, where they can put you in contact with a support group and you can meet other family members going through similar things.
Great information. Dr. Buczyner, thank you so much.
Thank you.
And thank you for joining us. I'm Julia Yarbo. For more information on Tenet service in Florida, please visit us at tenetfloridainternational.com or call toll-free at 1-855-854-4868.